Hello, my name is Fatima. I'm nursing student. Can I have your full name and date of birth, please?
Yeah, my name is Hamid Bernouz, 3rd of September 1984.
Okay. How are you feeling today?
Not really good, that's why I'm here.
Okay. Do you have any pain?
Yeah, my head, I have a huge headache.
Okay. When did the pain start?
It's been on and off since 7, 8 days ago.
Okay. Does any movement get the pain better or make it worse?
Yeah, usually by light, it really worsened my headache.
Okay. Were any treatment was useful?
Yeah, I'll take, when I take painkillers like Advil or Tylenol, it's okay for a couple of hours. And then it comes back, so I have to take another one.
Okay, how would you describe your pain? Is it burning? Is it sharp? Is it like stabbing?
It's sort of, right now, it's like stabbing.
Okay, stabbing.
But it's there all the time. It comes, it goes.
Okay, where is the pain exactly?
It's usually on the left side of my head. It starts, I have pain on my eyes, and then it goes all the way to my neck.
Okay, so so the pain radiated from
Yes.
that place to other places. Okay. How would you rate your pain from 0 to 10? 0 means no pain and 10 means you have the worst pain ever.
So usually it's when it's at the worst, it's obviously 10, but it's 8 when it's not very painful. It's like 6, 7, 8, but mostly 10.
Okay. And does the pain come and goes, or is it constantly hurt all the time?
It's constantly there, but sometimes even I'm at sleep, I have a headache. But sometimes it gets better, then it comes back where it was again.
Okay. And what treatments have worked for you before in the past?
So usually headache, all you do, sometimes I take hot shower. It relaxes my scalp nerve, I guess. It relaxes me a little bit, but 99% painkillers.
Okay. What do you believe is causing the pain?
I don't know, it could be the muscle tightness in my neck or my chest. I don't know, maybe dehydration, but I do take water almost 3 liters a day. I try to do that, but I really don't know. Maybe it's my eyes, I don't know.
Okay, and what is your pain tolerance?
Pain tolerance means, right?
You can tolerate the pain from 0 to 10.
Oh,
How you can
you know what?
tolerate?
Honest to God, is tolerate. Yeah, there's nothing I can do. I have to work with it, and I just take painkillers to so I could do my routine activities or tasks that I have to do, like going to work. But I do take the pills.
Okay. Is there anything that you would like to say about your pain?
No, I already told you pretty much. So the only thing is I have pain on my eyes. The light is, I usually use the sunglasses. I keep my eyes closed. Goes all the way on the left side, and then it goes down to my neck.
Okay. Are there any other symptoms that you think is related to this pain?
No.
Okay. All right. I will let the doctor know to see if he can get you a medication or any other prescription. I hope you feel better after a while. Is there anything else for me?
No, thank you.
Okay, thank you.
You're
Nice to meet you.
Yeah,
Thank
take
you.
care.
Bye.
Bye-bye.
Bye. Hi,
Hi.
my name is Fatima. I'm your nurse today. I'm going to perform and assess your head, eyes, ears, nose, throat, and your neck. Is that okay if I touch you?
Yes, it's okay.
Okay, we can start. I will inspect your head. Your head is normocephalic. It's aligned and fine. Your face is symmetrical. No facial drooping. And no lesion, no involuntary movements. Perfect. And the skin of face is appropriate to ethnicity. Now I'm going to palpate your head. Okay, it's a scalp. Is there any pain?
No.
Okay, so there is no pain, no tenderness, no lumps, no lesion. The hair's texture is fine. There is no lice and infestations. And the color is black and bright. Okay. Now I'm going to assess your eyes. The eyes are symmetrical. The eyelashes are well distributed. Eyelids are equal. There are no discharge. Can you look up for me? Okay. The conjunctiva is pink. The sclera is white. There is no discharge, no ptosis. Okay, now I'm going to assess your peripheral vision. I'm going to flick my fingers back and let me know when you see my fingers. Just
Okay.
say now, okay?
Okay. Now. 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 Now.
Okay, thank you. Your peripheral vision is intact. Now I'm going to assess your extraocular muscles. Just please look at my finger and follow my finger with your eyes without moving your head, just with your eyes, okay?
Okay.
Okay, perfect.
Thank you.
Your extraocular muscles are intact. You are able to follow my finger without moving your head, and this is true for cardinal gaze position.
Thank you.
Now I'm going to assess your pupils. I'm going to shine a light into your eyes. Okay, the pupils are equal, round, and react normal to light accommodation. I'm going to check and assess your visual, your central vision. Please cover one eye with your hand and keep it in 15 inches across. Could you please read the last line?
D E F P O T E C.
Okay, perfect. Your central vision is 20/20. Now I'm going to check and assess your accommodation. Please, I'm going to ask you to look up the wall over there, and I'm going to ask you to look into my finger. Okay? Your accommodation is intact. Your pupils are constricted and aligned with near vision. Now I'm going to assess your ears. Your ears are equal. I see that you have two ear piercing. There is no discharge. Okay, I'm going to palpate your tragus. Is there any pain here?
No, I don't have.
No? Okay. Your pinna, your mastoid. Is there any pain?
No, I don't have.
No? Okay. So I'm going to look through this otoscope with light. Because you are adult, I'm going to pull the pinna up and back. I'm looking at extra auditory canal. The extra auditory canal is pinkish in color. There is no lesion, no discharge. I'm going to look into your tympanic membrane. It's pearly gray. No redness, no blotting. See the next one. Up and back. Okay, the external auditory canal is pinkish in color, no lesion, no discharge. The tympanic membrane is pearly gray, no redness, and no blotting. Okay, thank you. I'm going to check your hearing. I'm going to do the whisper test. I'm going to pull one of your ear and whisper one word. So please repeat after me.
Arm.
Okay, I will do with the other eye.
Pen.
Okay, so good. Now I'm doing an assess the hearing with Weber test.
Okay.
To see, I'm going to check to see if your hearing is equal in your both ears. Okay.
Okay.
When I put it in your head, please let me know if you hear equally in the sound. You will hear the buzzing sound or ringing sound.
Okay.
Please let me know if you hear equally or not.
Okay. I hear equal.
Equally?
Yeah.
Okay. So I'm going to do the and test the air conduction and bone conduction with the ring test. Please let me know when you see the buzzing sound. Just say now.
Okay. Now.
Okay.
Now.
Okay. Perfect. So the air conduction is longer than bone conduction.
Okay.
Now I'm going to assess your nose. Your nose is symmetrical. I'm going to pull a light in your nose. Can you please keep your head up? Thank you. Okay. I'm looking at nose turbinates. Nose turbinates are pink and moist. And nose septums is in the midline. There is no perforation, no discharge, no full udders, and no polyps. Okay. I'm going to check your patency of your nose. Could you please close one of your nose and stiff with the other one, like that? Could you please do it with the other? Okay, perfect. So your nose patency is intact. Now I'm going to check your mouth. Your lips are pink and moist. It's symmetrical. There is no lesion and no tracks. Could you please say ah? Just say e. Okay. Your teeth are clear and white. There is no tooth decay, and the gums. Okay, the gums is pink, and there is no bleeding. Can you say ah? Okay. The uvula rises when you say ah. Okay. And the soft palate is pinkish in color. The white, the hard palate is whitish in color, and the tonsils are pink and are 2+. Okay. Thank you. Okay. Could you please stick your tongue and move your tongue from side to side? Okay, your tongue is pinkish in color. There are no thrush or whitish color, and there is no tremors, and tongue is in midline. Yeah, perfect. Thank you. Now I'm going to check your neck. Your neck is symmetrical. There is no jugular vein destination, no lesion. The trachea is in the midline. There is no deviation, and there is no thyroid enlargement. Okay, now I'm going to aspirate your artery. Could you please keep your breath? Okay, perfect. There is no broad sound. Now I'm going to palpate the carotid artery. Here. For left carotid artery is strong and regular in the right. And now I'm going to palpate the right carotid artery. Yeah, it's regular, in rhythm, and it's strong.
Thank you.
Now I'm going to check for any enlargement of thyroid. So I'm going to ask you please to swallow. Okay. There is no, the thyroid moves up and down when you swallow. Now I'm going to palpate the lymph nodes. I'm going to start with the preauricular. Is there any pain here?
No, you don't have.
No. Okay. Your post-auricular, occipital area, submandibular area, submental, sublingual, okay, deep cervical chain. This is the supraclavicular. Is there any pain?
No, I don't.
So there is no lymph nodes enlargement on those areas.
Thank you.
Hi.
Hi.
My name is Fatima. I'm your nurse today. I'm going to do the focus assessment on thorax and lungs. Are you okay with that?
Yes, I'm okay.
Can I have your name, please?
Lady.
Okay. Can I have your date of birth, please?
March 11,
2014.
2014.
Okay, let's start. Yes, I'm here. Okay, I'm going. I'm starting and looking at the anterior thorax. Can I see it? Okay. Your anterior thorax is equal bilaterally, and there are no lesions. and there are no accessory muscles used. Respiratory pattern is regular. There is no respiratory distress. The color of lips are pink. There is no cyanosis. There is no shortness of breath. Now I'm going to inspect and palpate your thorax. Okay. Is there any pain here?
No.
Tenderness?
No.
Okay, there is no pain, no tenderness, no lumps. Okay, now I'm going to check and inspect the tactile firmness. I will put my finger in your chest. When I put my finger in your chest, please say 99. Okay? Say
99. 99. 99. 99. 99. 99. 99. 99.
okay, perfect. Your tactile firmness is equal bilaterally. Now I'm going to inspect and check the symmetrical expansion. Okay, I'm going to put my finger just below the diaphragm process and ask you to take a deep breath. Take a deep breath, please. Like this. One more time. Okay. Your symmetrical expansion is equal. When you take a breath, your lungs is equally expand. Now I'm going to percuss your lungs. I'm going to start the epiphysis of your lungs. Okay, let me. Okay, thorax is all resonance in percussion. Now I'm going to oscillation the lungs. Okay, I'm going to oscillate 3 breath sound that start with bronchial sound.
Okay.
Take a breath. The bronchial sound is harsh, it's high pitch, and it's loud. I didn't hear any cracker sound. Now I'm going to check the bronchovesicular sound, which is located in first and second intercostal spaces. Take a breath, please. The bronchovesicular sound is less high pitch than the bronchial sound, and the inspiration is equal with the expiration. Now I'm going to listen to the vesicular sound. Okay?
Okay.
Let's start with the epiphysis of the lungs. Take a breath. The vesicular sound is a little low pitch, and inspiration is shorter than expiration. When I listen to the lines, there is no whistles, crackers, and there is a good air entry on all loops, equal expiration. Thank you.
You too. Bye.
Today I'm going to assess the heart and peripheral vascular system. Let's start with the precordium. Can I see? Okay. Thank you. Precordium is equal, symmetrical. There is no visible lifts or heaves or visible pulsation. Now I'm going to palpate it for any vibration. Is there any pain?
No.
Okay. No pain?
No.
Okay. Now I'm going to palpate for apical impulse. Apical impulse are located on the 5th intercostal on the mid-clavicular line. For women, it's under the underneath the breast. Okay, I could feel a quick beat here. For her, the apical impulse is 2 centimeters.
Yeah, that's my heart.
Yeah. Now I'm going to listen to the different sounds of the heart by 5 auscultatory areas. Let's start with the aortic area. Aortic area is located on the 2nd intercostal space on the right external border. Okay, let's start. Could you please write down here. Thank you. 2nd. Okay. Here is aortic area. The S2 is louder than S1. Now I will move a little bit to the left on the 2nd intercostal space. On the left side of external border, it's called pulmonic area. In pulmonic area, I could hear S2 is louder than S1. Now I'm going a little down to the 3rd intercostal space on the left external border. We call it air point. In air point, I could hear S1 and S2 equally. Then I will move a little bit down to the 4th intercostal space. It's called tricuspid valve area. Here is S1 is louder than S2. Let's move to the 5th intercostal area. No, just lie down, please. Yeah. 5th intercostal area on mid-clavicular area. It's mitral valve. Here is S1 is louder than S2. Now I'm going to listen for any murmurs on the S3 or S4. I will use the bell of my stethoscope. Let me check. I couldn't hear any murmurs on S3 and S4. Now I'm going to check for peripheral pulses. I'm going to start with the upper extremities. You can see it a little bit. Sit down. Okay.
I already did that.
Okay. Let's look at your arm for color, discoloration, or tension, or lesion. There is no discoloration, no lesion. The size are the same. So let's start with the brachial pulse. I will do at the same time. Can I see your arms?
Yes.
Yeah. I will put my 2 fingers here for brachial pulse. Yeah, brachial pulse are strong, equal bilaterally, and regular. I will move to the radial pulse here. Radial pulse are equal bilaterally, strong and regular. I will move to the palmar side. It's strong, regular, equal bilaterally. Okay. I will go and check for epitrochlear nodes. I can support one of your hand, and then I will do the epitrochlear nodes for finding any swelling or tenderness. Do you have any swelling or any tenderness here?
No.
No. Okay. I will check the other hand too. I will support it and do with this hand. Is there any swelling, any pain?
No.
No? Okay, perfect. So it's normal. There is no pain, no swelling over here. Now I'm going to check the peripheral pulses on the lower limbs. I will start with the legs, but let me check for temperature of feet and leg. For everything is normal. Now I'm going to check for legs for color, size, trophic skin changes. There is no discoloration, no trophic skin changes, or no tension. Now I'm going to palpate the femoral pulse. I will put my 2 fingers here. The femoral pulse are equally bilaterally. I will check. Could you please bend your knee? I put my fingers under your knee to check popliteal pulse. They are strong, regular, and equal bilaterally. Now I will check the dorsalis pedis pulse. It's under the big toe. Can I check both of them, please? Dorsalis pedis pulse. No, I will check that. I will show. Yeah. And here, it's the pulse are here are strong, equally bilaterally, and regular in rhythm. Now I will check posterior tibialis here. Posterior tibialis pulse for both of them. Yeah, they are strong, regular, equal bilaterally. Okay, thank you. Thank you.